There's this mindset that depression, anxiety, grief is a normal part of aging, but it really isn't.
I think mental health is very important no matter what age. I think it's starting younger and younger, but as the generation is older, they definitely struggle with, where do I go to? Is there a place I can get help, and who do I turn to?
Mental health, unfortunately, has a negative stigma attached to it. Once they join our program and they realize there is no judgment with our program at all of our staff is understanding, we validate their symptoms, they start to really enjoy and open up, and that's the benefits of our program.
A lot of times it's just giving them the coping skills and tools, and they do it themselves. It's the interactions with their peers and realizing, hey, you know what? I'm not alone. I'm not the only one experiencing this. And even if their peers aren't going through it right now, maybe they've had a similar experience in the past and they can share that and have that realization of, yeah, it's not just me. That really helps them.
Senior Life Solutions is a mental health program that does group therapy sessions. We do them 3 days a week, Monday, Wednesdays, and Fridays.
Typically, you're here from 9 o'clock till 12:15. And we also do individual therapy, one-on-one. And we have a psychiatrist that they see once a month. Our program is very easy to access. People can just call us and talk to us, and we can get them in, or a doctor can refer them, but we don't need a doctor's order.
When they come here, I think they quickly pick up that this is a safe space, and I am comfortable to share some of my most difficult life transitions that I have gone through. And I see quickly that sense of being able to relax and share.
It almost feels like a family environment. It's like you're sitting there with your friends. Everybody just kind of clicks and you just get talking about life events, families. It doesn't take long for somebody to become comfortable and start opening up.
My favorite part of the job is being with the seniors and just making them feel comfortable and knowing they're not alone. And it's great. We have a lot of fun, and their smiling faces make my life feel good.
It brings them together with their peers, other people that are suffering the same symptoms, and helps them grow from there.
For senior citizens, I feel like a lot of times they have that stigma that they can't get help, or that they're too afraid to reach out.
Whether it is loss of their job because they retired, loss of a loved one, whether it be a spouse or a family member, loss of a pet, and then the symptoms just start to escalate, where they start to isolate, they start to have a loss of motivation in doing activities that they used to once love to do. Just typical life changes that occur in the senior population is why we focus on the seniors.
I stress with the patients that our mental health is just as important as our physical health. It's like the left and the right hand working together.
And we want them to know that we're here to help them, and they don't have to hide their problems and deal with them on their own.
You can just see them blossom as they move through the program and find themselves again.
It's giving that affirmation that it's okay to ask for help. Patients do not need to be in a crisis to come here.
It starts at that phone call from a referral. I will call them back. I explain the program. I answer all their questions, validate their concerns, and then we set up what we call an intake. They come in, we review everything with them, their health history, the symptoms that they're having, make sure they qualify, get them introduced to our medical director. And the trust just starts from that first phone call that I make to the patients once we get the referral.
Our team here, we're very encouraging and supportive. We make our patients laugh. We even sing with our patients, just uplifting them and letting them know there is a purpose for them and life will be better than it was when they walked in the door.
You see their confidence build, their bonds, the bonds they have. Like, they exchange phone numbers because they want to keep in contact with each other.
I didn't know anything about the program prior to starting here, and now that I've been here 3 years, Just from seeing patients that were here before me to patients now that I've gotten to know, start to finish, it is amazing the transformation that they make. They come in here not, very timid to leaving and thinking this was the best thing they've ever done in their life.
What I would say to someone who is unsure about seeking help is just please give it a try. There's a lot of other seniors out there going through the same symptoms that you are. Asking for help is a strength. It is the first step into you feeling better and getting your life back the way it used to be.
And know that there's help out there where we can bring people in, and then when they leave our program, know that they have the tools to thrive. It is just so rewarding.
It is okay to take care of your mental health. It's not something we have to be embarrassed about. It's not something that we have to keep under wraps. And I feel fortunate that we have Senior Life Solutions to provide that avenue for them to come in and be able to take care of their mental health.